My name is LaFarre, and I'm a student at Samyama University in Oakland, California. I am in my final stage of getting my doctorate degree in nursing practice, and this is my DNP project. The objective of this presentation is to encourage healthcare providers to achieve cultural competency with respect to LGBT healthcare needs, and also encourages you to evaluate your knowledge of LGBT healthcare issues as a healthcare professional. Some exciting people helped me put this presentation together. I'm going to do some shout-outs, but right now, first I want to tell you what the presentation is going to be. I will show you a few small clips on just the interaction between patients from LGBT community and healthcare staff. I also have a PowerPoint presentation to show you. At the end of the presentation, there is a 18-question survey that I'm asking you to take to evaluate your knowledge of LGBT healthcare issues. I was thinking about how important it is to talk about your sexuality, your sexual orientation, and identify your gender with healthcare professionals. It is difficult, and probably it's a community that is very marginalized. So when you get diagnosed with cancer, it's amazing so many challenges you have to face, and you have this on top of it. You cannot speak to your doctor about it. There are so many barriers that you face. Then I start thinking about the movie I saw called Southern Comfort. This film was made in 2001 and is a documentary about the last year of the life of Robert Eads, a transgender man. He died of cancer at the age of 53, had 2 children, and was divorced. He started having vaginal bleeding and pain and was never screened. He could not get anybody to listen to him. This went on for a while until he was diagnosed with cancer. He was able to find somebody in Georgia to treat him. He lived with his cancer for 3 years. It's an excellent movie that emphasizes on barriers and disparity that LGBT community face every day in healthcare. Robert Eads could have been diagnosed earlier with all the warning signs that he had, and he could have been cured. When he was diagnosed, he was on stage 4 of cancer. Healthcare disparity exists in LGBT community. LGBT are at higher risk of certain conditions such as HIV, eating disorder, alcohol, and substance abuse because they wait too long to seek healthcare. The LGBT often not treated with dignity and decency they deserve. Here's a clip of an excellent example how they are being treated in a real world.
Excuse me, you have not completed the form. The gender box has not been marked.
You do not have a box for me.
What do you mean? We have both female and male boxes.
I don't identify as either of those. Maybe you should update your forms and have more options for gender. It would be more inclusive. But I guess, for now, female is close enough.
Female it is. Dr. Jackson will see you shortly.
Mommy, there's more than 2 genders?
Shush, darling. I will explain later.
Transgender is not a mental disorder, and transgender behavior is not abnormal or deviant. LGBT must not be discreet about their sexuality around children. In order to understand the LGBT health disparity, one must recognize of the oppression and discrimination that the LGBT has suffered throughout history. Researchers suggest that LGBT face health disparity associated with discrimination and social shame, while discrimination against LGBT has been associated with significant degree of psychiatric disorder, substance abuse, and suicide. There are physical and social determinants in LGBT community.
It looks like I just saw you last week. It's too soon for your hormone therapy.
I think I have strep throat.
Oh, okay. Let's take care of this form then. Charlotte, 15, female.
Actually, I go by Charles and I am non-binary.
Yes, but your medical form indicates that you are a female. It's easier to address you in line with your gender markers for medical reasons.
To understand LGBT health disparity, we must recognize and consider social and physical determinants affecting LGBT health. They have been discriminated against in employment, in housing, adoption, and retirement benefits. There are no adequate age-appropriate social programs for LGBT community. There are not sufficient culturally skilled and sensitive healthcare providers in LGBT healthcare delivery system. Physical determinants that affecting LGBT health are safe neighborhood, safe housing, safe meeting places, and safe and easy access to healthcare when they need it.
I do not need to prescribe any birth control today since your partner is also a female.
Oh, okay.
Okay, so moving on. So what is your sexual history?
Currently, I'm having sex with both males and females.
So you are bisexual?
Oh, actually, well...
How does your boyfriend feel about that?
There are challenges to assess LGBT patients. Clinician and primary care staff do not possess the knowledge and ability to adequately and efficiently deliver healthcare services that fulfill the social and cultural needs of the LGBT community. They suffer due to discriminatory behavior inflicted on them by healthcare professionals, which make it challenging to attain care and seek professional medical help on time. The fear of coming out and being discriminated when revealing gender identity is real. This issue itself raises the risk of substance abuse, self-destructive behaviors, suicide, and depression among the LGBT.
Tell me about your pain.
I have been having some pain,
How often?
mostly during intercourse.
Every time or once in a while?
Lately, every time.
How long have you had this pain?
About 3 months. I had different problems since I was a child.
Related to your intersex condition?
Yup. I am intersex. It means that my reproductive and sexual anatomy does not fit men or women, and is an example of how sex is a spectrum. Intersex isn't a condition. It's similar to people who have red hair.
Wow, I have never seen anything like this before. This is very interesting.
It's common for intersex people to have intersex plastic surgery when we are small children or when we are in our youth. This causes plenty of emotional and physical complications through our entire life.
These are some facts regarding LGBT community. LGBT youth are 2 to 3 times more likely to attempt suicide. Young LGBT is more likely to be homeless. Lesbians are less likely to get preventive services for cancer. Gay men at higher risk of HIV and other sexually transmitted infections. Lesbians are more likely to be overweight or obese. There is a lack of social services for elderly LGBT. The risk of physical, sexual abuse, and mental health has raised to an astonishing and alarming level. There is a need to culturally appropriate care to address these individuals' health issues. Elements leading to lower health outcomes, social inequalities, and healthcare disparity must be reduced and eventually eliminated.
Hey, Ashley.
Yes?
Your patient in room 2, he does not want me to take his vital.
Oh, really?
So, he wants to be called Joe, but his paperwork and ID say Josephine Cruz. He seems very upset. He told me that the receptionist also called him Josephine.
Hi, Josephine.
How about you start by actually reading my forms and then asking me, how would you like me to address you?
But I know your name is Josephine.
My name is Joe. This is very interesting because your forums online are very progressive and I thought your staff would reflect that. I'm surprised that staff does not get it. You could at least call me by my chosen name. I just don't feel comfortable talking to you about my treatment. To treat me, you need to know who I am. I don't want to leave now. I've been misgendered and I don't want to stay.
Addressing barriers and intervention and social cultural levels will serve the LGBT. LGBT must have a better access to culturally sensitive care. A fundamental change in the primary care setting is needed to address the healthcare disparity in LGBT patients. At the end of this presentation, I just want to add that healthcare providers should be prepared to discuss sexual orientation and gender identity with their patients. Institutional barriers exist for LGBT community. Lack of adequate clinical training and supervision to work with LGBT clients in our educational system exists. Providers do not feel competent to assess a person who is LGBT in a clinical setting. LGBT sexual behavior are not abnormal, and we must accept them for who they are. Thank you.